Next is going to be Brett Poniros, and Brett's actually a chiropractor and a strength and conditioning specialist. He owns and operates Apollo Performance Chiropractic, which is a rehab practice in Pleasantville, New York, where he focuses on blending manual therapy and strength and conditioning principles to help athletes and active individuals bridge the gap from rehab to performance. And I would tell you, Brett's a lot more than just a chiropractor. He really has that total athlete in mind when he's evaluating patients. And Brett's going to talk to us today on strength training for the overhead athlete.
First of all, I hope everybody's having a good morning. My name is Brett Poniros, and I'm extremely excited to be here. So on behalf of Rothman having me, I'm extremely grateful and humbled to be part of a really great group of presenters right now, and just excited, and hopefully I can give you guys a little bit of information that you can use going forward. So, title of the presentation is Strength Training for the Overhead Athlete, why it's important to focus on more than just mechanics, sort of playing off a little bit on what Dr. Nick Serio just talked about. So, I have nothing to disclose. All right, so a little bit about me. My name is Brett Poniros. I'm the owner and clinician of Apollo Performance Chiropractic, and also a strength and performance coach at Athletes Warehouse. So I came into the rehab field probably like a lot of others do, which is unfortunately through injury, which I said is a blessing and a curse. So as a college baseball player, I dealt with a ton of chronic hamstring injuries and then some low back pain, which I believe stemmed both from just the unidirectional rotation as well as my infatuation with strength training once I got to college. I was a 3-sport athlete in high school. And once I had a little bit more time in between seasons, I really dove into strength and conditioning. I didn't have any sort of guidance. I didn't really know quite what I was doing. I basically tried to move heavy weight as often as I could, and I ended up paying the price for it in a lot of different ways. Now, the reason I'm telling you this is the people that ended up helping me the most just happened to be, after a long journey, a chiropractor and a strength and conditioning coach. And going through that process, I realized, hey, this is a really cool blend and marriage of philosophies. So I decided to pursue that. After Franklin and Marshall College, I went to the University of Bridgeport, got my doctorate of chiropractic. In the meantime, also got my CSCS and started working at Athletes Warehouse, and thought, how can I blend this into a practice that focuses on athletes and active individuals and sort of helps them achieve their goals. So from a personal side of things, I come from a big family of 7, so I have 4 siblings and a loving fiance now. I absolutely love learning. I call myself a functional sports medicine obsessed learner. Everything from nutrition to sleep to performance, obviously, in rehab. Any sort of podcast or anything, I'm all over it. I am a lover of hard rock, which people tend to find surprising, and just love being outside. So let's talk a little bit about the roadmap going forward for this presentation. What I want to do is obviously provide tidbits for my rehab professionals. I realize that we have a lot of athletic trainers, probably a lot of physical therapists, hopefully some chiropractors, strength and conditioning coaches, and then some doctors and physicians along the way as well. So I want to provide the goals of strength and conditioning, identifying needs of the overhead athlete and the person in front of you and how to best utilize those, navigating some of the literature that exists, and more so than anything is reconciling some of the literature that exists and pulling tidbits from that so you can know how to best apply strength and conditioning principles, rehab principles, in order to impose some sort of benefit on the person in front of you. I do want to go over some approaches to training, talking about certain patterns that we like to train, different philosophies, and how you can apply those. And then the big thing is how to move forward. Like I said, the goal of this is for you to get a few things, maybe challenge your beliefs a little bit, get a few things that you can apply either in the clinic this afternoon, tomorrow, or if you're a physician and you're interested in the topic, how to look for referring professionals that might implement some of these strategies. Or when you're writing a prescription, to say, you know what, I think based on my examination here, this person could use some lower body strength. Or why don't we try loading this pattern a little bit? I know people don't like to necessarily overstep their bounds, but by educating yourself a little bit, I think we open the discussion in terms of being able to work with each other going forward. So let's start with some of the goals of strength and conditioning. The number one goal all the time is to keep the athlete healthy and on the field. I think this is a mistake that a lot of athletes make when they go into strength and conditioning. A lot of new strength and conditioning professionals might make as well, is that they believe that what they're trying to do is make the athlete bigger, faster, stronger. And yes, while that might actually help the athlete be healthy, a lot of times what you can do is end up loading positions and ignoring some of the basic needs that the individual might need in order to address some of their health concerns and staying on the field. And this always starts with a good examination and attacking low-hanging fruit. And I'll talk a little bit more about that idea of attacking low-hanging fruit later in the presentation. Increasing performance. So as long as we know that the athlete is staying healthy, of course, we're trying to increase performance. And that might be power training, strength training, stability training, again, whatever you think that the athlete might need. And this really, what I like to say is, if you can attack the floor before you attack the ceiling, you're going to be in a really, really good position. And again, we'll get into this a little bit more later, but if you look at, for instance, the chart on the side here. Now, if you're into the stock market, right, what you want to see in a stock is you not only want to see high peaks, but you want to see higher valleys as well. That means that you're at an overall upward trajectory. And I like to say, when I have rehab clients or performance clients, is if everything was just a linear curve, a linear direction straight up, things would be easy, right? But it's not. We go through things in life that bring us down. We might go through little injuries on the field that are uncontrolled, and there's going to be little valleys as we move down into that. So as long as we can keep an upward trajectory, keep our valleys high and our peaks high, we'll be good. Next thing, managing total stress. I think Dr. Serio did an absolutely fantastic job of talking about how to manage total stress in a multi-faceted way. We have to remember, we're getting a person for 45 minutes, an hour, maybe less if we have less hands-on time with them during the course of their day. There are plenty of other things that they're doing during the other 23 hours of their day. What is their sleep like? What are their social interactions like? We really have to think about that when we're loading this person. Are they trying to rehab a shoulder injury for baseball season, but they're also playing a winter sport right now? It's going to be basically a huge give and take. And while there is no perfect recipe to work through this, managing the total stress, asking questions, trial and error, and having some sort of subjective and objective measurement is going to be the best way to move forward. And increasing confidence. I think from a rehab perspective, a lot of you might know, if you get somebody with back pain, something that you're trying to do is not only decrease their pain, but show them that they can do the movements that they were afraid that they can do. Now, when we talk about increasing confidence from a strength and conditioning perspective, a lot of this is similar. Most athletes are dealing with some sort of bruise, nick, injury along the way. If you can give them movements that will give them the confidence that they need to step back on the field, the psyche that can influence is huge. So we do this by, I like to say, giving a person the hardest thing that they can do well. You don't want to set the person up for failure necessarily all the time in a weight room. You do want to challenge them, but you want them to be confident in what they're doing, and you want them to have some sort of a stimulus going forward. So for my rehab professionals out there, like I said, I am partial to you, so this next slide is for you. As you can see, when I talk about rehab, I'm essentially looking at the exact same principles as before. Instead of keeping the athlete healthy and on the field, it would be getting the athlete healthy and on the field. You still want to increase performance. I think the best rehab professionals are the ones that can implement strength and conditioning principles in order to make the person better, not only get them back to where they were, but to have them actually be better when they come out of rehab as when they're in it. Managing total stress. Rehab is all about stress management. If you can implement the right principles, you're going to have a good effect on the body, get good systematic or systemic hormone releases in order to heal tissue, in order to increase performance, and also increase confidence. And so this is a quote that I really like from Phil Glasgow. He's a PhD in exercise scientist out of Northern Ireland, and that is that rehab is training in the presence of injury. And I truly do believe that. And I honestly tend to think that in our world today, we tend to chronically underload people that are in rehab. And that's why I know the title of the presentation is strength and conditioning, or strength and conditioning for the overhead athlete. But I truly do believe that in the rehab setting, implementing strength and conditioning protocols and principles is going to be the best bang for your buck if you have limited visits and limited time to creating a lasting change for your athletes, especially your overhead athletes. Okay, so now getting into needs a little bit. And like we said, everything starts with a good evaluation and a good plan. And you have to reconcile what you see in the sport versus what you see in front of you. So these are just some of the things. The way that I approach training a new sport or training somebody who in a sport that I'm not necessarily familiar with is I go to some videotape. I think that we all have the training of anatomy and biomechanics on a basic level to at least understand and watch a movement and say, okay, here's what is demanded from each joint, each muscle group during a different portion of this. So here are some of the things. If we run through, let's do sort of the exercise here. Now it's a little odd because on the tennis serve, it goes from right to left, right? So initially, most basic things, obviously, you need shoulder flexion. You might need a little bit of patellar loading with that knee over toe on the front leg. As they get into that upward phase there, you see massive external rotation at the shoulder, valgus stress, really triple extension through the ankle, hip, and thoracic spine in order to get you there, explosiveness, and then finally, as we go into the landing phase, it's going to be single leg stability in an eccentric fashion. So again, there's just a list on the side here of things that an overhead athlete probably needs: single leg stability, extension through the hip and spine, rotational capacity, trunk stiffness, on and on. There are probably a number of things here that you would actually say that aren't even on here, which just goes to show at any given time, you may have a million things running through your head. How can we best train this athlete to what they need? And coming from somebody who's tried to do it, who's young in the strength and conditioning field, you are never going to hit everything that you want to hit, both in a session and a lot of times in a training plan. Even if you're getting an athlete 5, 6, 7 times a week to train, you're never going to be able to do everything that you want in a session, which is why it comes back to attacking this low-hanging fruit. For instance, if you're doing an evaluation on an overhead athlete and you see, you know what, they can really press a lot of weight in the overhead position, they look really good, but they can't even balance on one leg. Even if they're dealing with a little bit of shoulder stiffness, shoulder pain, elbow pain, what I implore you to do is to challenge the bias, challenge your inkling to just attack the shoulder with exercises and say, this might be part of a larger system. This might be a problem that is derived from a stability issue at the ankle, a stability issue at the knee. And by trial and error and incorporating certain exercises into this plan, you can start to blend those certain things back into a return to throw program and simply see how it goes. And that's why I always say attack the low-hanging fruit, because while you won't be able to attack everything, you want to have as much of an impact as you can on these specific athletes in a short amount of time. Also reconciling what we know with the research. For instance, with force plate data, we're starting to see that the peak impulse in that drive leg, meaning how quickly can they generate eccentric to concentric force, is ideal for performance and for velocity. So if you can see that an athlete might be lacking in their capability to produce power, that might be the driving force in your strength and conditioning or rehab program to try and get them back on the field. If they can't produce force throughout the kinetic chain, you can bet that the most vulnerable places, probably the elbow, shoulder, upper extremity, are going to take the brunt of the force. I also want you to conceptualize the idea of regional interdependence during this. Regional interdependence being the idea that what happens at one section of the body impacts the forces at another. So a good example that I like to talk about is hip rotational capacity as well as thoracic spine. We see athletes all the time that have biases towards either internal or external rotation, where they might have the total arc of movement that the quote unquote normal variation might have, but they're extremely biased into one side of rotation. Now we know, say, picture the drive leg of a pitcher, the side that's touching the rubber. We know that at a certain point, they're going to have to fire that leg into internal rotation or that hip into internal rotation in order to impart force down the mound and up the chain into the shoulder, arm, elbow, etc. Well, if they're extremely limited into internal rotation, but have a ton of external rotation, that is greatly going to affect how their body personally drives force and creates force. Now, this doesn't mean that you have to just try and crank the hip into internal rotation, give them internal rotation drills. Sometimes the anatomy may dictate the forces that are going through. So what you can do is try and maybe change the way that they're lifting a little bit to better adapt their body to create force, whether that's changing their foot position on the mound to pre-position them into external rotation. That might be the way going forward. Don't try to just fit them into a box because you know typically that a pitcher might need internal rotation. Adjust them so that they can better create force the way that their body feels comfortable doing it. So that brings us to training patterns versus training muscle groups. And I believe that this does fit into the idea of isolated training and chronically underloaded people. Again, getting the most bang for your buck. So once you have an idea of the individual components that an overhead athlete needs in order to be successful on the field, what I want you to try and challenge yourself to do is to, instead of isolating those given components, try to train patterns in the weight room that hit multiple of those characteristics at a specific time. I like to call it essentially getting the most bang for your buck, right? Accomplish as many things as you possibly can. Mechanical changes will often happen specifically with skill coaches, right? So if you see that an athlete is unable to get into layback, for instance, as Nick talked about in the prior presentation, there's going to be very few things that you can do in the weight room to mechanically cue that person to get into layback, even if you think that's what they need. So here's where the blending comes in. What you can do, however, is design and create patterns and exercises that will have the building blocks for them to be able to create force in those positions. So here are some of the compound movements that we like to use: a crawl, a press, carry, row, lunge, some form of global extension, and then obviously lower extremity power. So let's take a look at the crawl in the picture in the top left. If we think about what the athlete is doing here, for those of you that have tried or utilized a bear crawl before, you know that it's really a harder exercise than it leads on to be. What the athlete is able to do here is have cross body symmetry, right? Also the mental capacity to be able to say opposite arm, opposite limb, which I think is very underrated. You see the wrinkles on this athlete's shirt to show that there's some sort of sling pattern that's firing during this. They're creating that cross body stiffness. And if you look at his right arm, he's loading that right arm into upper rotation. You can even see the inferior border of the scapula almost jutting out over the rib cage as it glides. This is more so what I'm talking about training patterns, right? And allowing, if we know that the scapula has to glide over the rib cage in a healthy way during throwing, let's find a way to load this pattern so that we can mimic what they're doing while also creating a general stimulus and a challenging stimulus for the body to adapt. And let the skill coaches then design drills that will marry what you're doing in the weight room to what they need to do on the field. And again, I want to talk a little bit about the pain science, this pain science trend, and I think the bastardization of biomechanics in a certain way, in the rehab setting as well as in the lifting setting. There's been this trend to say that biomechanics might not matter as much as we think they do in terms of pain reduction and lifting. And I get that from the confidence building perspective, but the problem with that is that we can't throw arthrokinematics out completely out the window, especially in an athlete that repetitively has to create force over and over again. So for instance, if we know that extension of the shoulder causes, in general, just as a paired motion, anterior glide and anterior roll of the glenohumeral joint, we know that there are plenty of structures in the front of that shoulder that support anterior stability that are likely going to get, butted on and butted on and butted on. And that's where we tend to see those biceps tendonitis flare-ups, right? Where we have a really, really sore and tender long head of the biceps with palpation. But the bottom line is, when we tend to work the scapula into retraction, posterior tilt, those things tend to go away. And that just shows us that we can't be willy-nilly with how we prescribe these exercises. So if you're looking at a row, for instance, and you're looking at somebody that is driving the elbow posteriorly and getting anterior roll of the shoulder of the glenohumeral joint, you really have to control them, because what will happen is the body will reorganize itself, and what it's doing in the weight room, it will tend to carry out onto the field. And that's really what we want. So design exercises that allow the body to function as it wants to, or mechanically should, on the field. We really, really like to use exercises that allow the scapula to move freely in the overhead pressing movement. So if you think about something like a bench press, you're pressed up against the back. You typically have to flex or adduct the arms with the scapula in retraction to create stability. While we do use this as a global loading pattern just to create strength and impart a stimulus, what overhead athletes truly need to be able to do is understand where their shoulder blade is in space and how to properly load that and glide it along. Okay, so there are 2 exercises right here that are pictured, really 3 if you actually consider the posterior tilt that's happening on the bottom left there. But being able to manipulate and mobilize the shoulder blade into upward rotation is absolutely key. And I want to draw your attention to the aside up on the top right. This was an interesting study that I came across. It doesn't necessarily have to do with the overhead athlete directly, but the study is titled Anterior-Medial versus Posterolateral Hip Musculature Strengthening with Dose Controlled in Women with Patellofemoral Pain. Now, the results of this study were very interesting. It's that we typically think that with patellofemoral pain, we're strengthening the lateral hip because of the mechanics, the IT band, yada, yada. What it actually came out to be was that strengthening of the adductor group or the anteromedial portion of the leg actually resulted in just as much pain decrease as the other did. So again, sometimes the stimulus and general strength goes a long way. Don't overthink your training. So navigating the confusing seas. This is where I like to talk about the double-edged sword of research. And in order to be a good study, we really have to try and isolate a certain variable, because if we don't, we tend to hear people say, well, you know, there were so many different variables. How am I supposed to know if this wasn't the cause of their pain decrease, or this or this? So this is the double-edged sword of research that a lot of our researchers are faced with. And in order to be a good study, they have to do that, but then we critique them if they do a multifaceted study. So again, the goal that you should have is when you come across a certain study, pick the tidbit out and then say, how can I apply this into a global system, into the person that's presenting in front of me? So for instance, with ranges of motion, we've seen recently IR deficit in the shoulder or GERD be a component of possible injury risk. It's now since moved to total arc a little bit more, which I think is beneficial, because if you do have somebody with limited internal rotation, it could likely be an adaptation to what they're trying to do on the field, which is obviously rapid throwing. The posterior capsule tightens up as a result of trying to decelerate that arm. In terms of strength, we've seen that external rotation strength deficit or low external rotation strength comparative to normative standards might also be a risk for injury. Now, in my opinion, this does not mean that what we need to do is throw everybody on a dumbbell or a band resisted simple external rotation exercise, because from experience, what we have seen is our strongest athletes in our compound movements, the ones that can squat the most, deadlift the most, press the most, are also the ones with the strongest external rotation. So that just goes again to say, okay, let's reconcile the research, but now apply it into a global strategy where we say, if we prioritize these compound heavy movements, we can assume that these global movements will impact people on a very local level. And grip strength has been closely linked to looking at that external rotation strength deficit. So now you have a plan. You say, okay, let's load these people into compound movements and let's monitor them with grip strength. And so I think this is a way that we can impart a very structured plan to our athletes. And finally, scapular dyskinesis. I have a problem with this because, first of all, the evidence is extremely conflicting in the prevalence as well as whether or not it's an injury risk. And the problem is, as you all know, what is scapular dyskinesis? We can put out a definition, but when someone's presented in front of us, who's to say the dividing line between who actually has abhorrent motion of the scapula versus who does not? So what I think we can agree on, however, is that if you're causing pain into upward rotation or movement of the scapula and it just looks bad, I think that's something that can definitely be addressed. But what I don't think you need to do is harp on every single individual movement that someone does, and definitely don't tell them that they have poor movement of their shoulder blade and that it's likely to lead them to injury. Because the truth is, you can't say that with 100% truth. And the other truth in the matter is you don't even know if you're necessarily going to be able to change that. And finally, I want to draw attention to the cycle of learning here, which, as most of you are familiar, we get a new piece of literature, we read it, we're a little bit uncomfortable in the bottom right there because we've been doing something for a certain way. This might change the way we want to be good clinicians, so we implement it, we move forward with it, we get comfortable doing that, and then all of a sudden a new piece of literature comes out. So I like to say in this field, adaptability is more key than absolutely anything. The final thing I want to talk about is creating a philosophy, which I think is huge. And those of you, you'll probably recognize several words in the top right if you're a rehab professional: MDT, DNS, SFMA. These are all different systems that have been created by people. And while we have people that really adhere to specific systems, the biggest thing that I would say is if you have a system that works for you, that is best for the patient, you stick to that. When it comes to strength training, the pyramid that was developed here at Athletes Warehouse and taken from bits and pieces from other places is you're a human first, you're an athlete second, you play your sport third, and your position fourth. So this simply means if we get even a 15, 16-year-old athlete that is maybe a high-level player, but they cannot perform basic movements like crawling, squatting, hinging, we prioritize that because that is the foundation for which all other movements are completed. And I'm only 27 years old, but I'm going to get on my old man, get off my yard soapbox and say, it's true that people aren't really growing up the same way that they used to in terms of play, in terms of foundational movements. I think physical education classes have changed in terms of being able to push kids through these foundational movements, and just play in general has changed. So, and that's not to say that it's any one specific fault, but it can be our job now to intervene at a very strategic point and say, okay, you're coming to see me for rehab of your shoulder. We're going to address that. But guess what? We're going to teach you some basic movement principles that are going to influence the way that you play your sport, that you step on the field for the rest of your life. And we're going to try and load those patterns to create a good foundation. After that, we can work on change of direction and then, basic power principles that go along with being an athlete. And finally, we can get into actually addressing what their needs in sport are. But remember, don't be afraid to start at a very basic level. Have somebody crawl for 5-10 minutes and just see the fatigue and the struggle that they go through, and just know that you are imparting a useful change. Even if they are an overhead athlete, you're going to create an adaptation that they're going to be able to use in their sport. And as long as you stick to those overarching strength and conditioning principles of some form of progression, meaning or regression based on where the athlete's at, always move forward, don't be afraid to load. Load management and recovery, give them time to recover. That's where the adaptation occurs. And pain-free movement in relation to the movements that you give them should not cause a new or prolonged discomfort. I do want to clarify that it's okay to have discomfort, in a certain area, but make sure that they are then loading going forward. So some final thoughts. Evaluation of movement needs is always key. Prioritize global strengthening. You'll have local effects as well. Reconcile the narrow scope of literature, overarching concepts. Find a method you like, but don't forget that adaptability is key, and communicate and create an amazing network. I think Rothman does a phenomenal job of this with communication. If we can create a good network, we can fill in the gaps in our knowledge, and we can give the patient or client in front of us the best that we can possibly give them. And finally, thank you. Like I said, extremely humbled to be a part of this, and please feel free to reach out. I love discussing things with like-minded professionals, and honestly, even more probably people that disagree with me. So thank you again, and I hope that you guys got some information out of this. And like I said, feel free to reach out. I'd love to hear from as many of you as possible.